Hello, everyone, and welcome to today's episode. Today, we're talking to Deborah Evans. Deb is the founder of REMEDI HEALTH down in Winchester. She specialises in perimenopause and menopause, working with women who really need to understand what they can do with their health in order to improve their outcomes. With a wealth of experience over a 35-year career in pharmacy, Deb brings so much information to this discussion, and we really hope you enjoy it. Deb, it's a pleasure to have you.
Thank you. Thank you for having me.
Absolute pleasure. So, Deb, talk to me about the work that you're doing with REMEDI.
Well, where to start? So we started REMEDI Health in Winchester just under 2 years ago. And the vision was always to bring a whole range of clinical services in a high street setting that were really accessible to the public. You know, individuals wanting access to good quality evidence-based information about their health, being able to access a blood test literally as a walk-in, as well as a range of other services like vaccination, treatment for sort of both long-term and short-term conditions, earwax removal, skin health, nutritional therapy, a whole range of accessible services for people.
Yeah. And I know obviously in the introduction I mentioned about your work within perimenopause and menopause and that area of focus for yourself. How did that journey start for yourself and where did that focus come from?
Well, from a personal point of view, I've been through both the perimenopause and menopause and experienced significant health challenges during that time. So from a personal point of view, a real passion to be able to help other women going through what is inevitable. But I come from a background of reproductive and sexual health and an interest in women's health generally. And though that's extending to men now as well.
Give us the long history and the long version of the story on how you got involved in the work that you're now doing with menopause and sexual health.
So my passion for perimenopause, menopause, reproductive health really stems from being able to give women good information so that they're empowered to make choices, either about contraception or if they're trying to get pregnant, through to protecting themselves from sexually transmitted diseases. And of course that extends to men as well, but I suppose I have a particular interest in women having had children, been through that journey myself, and inevitably into perimenopause and menopause. All women will go through that transition as their hormones change, and having experienced it myself personally, and just knowing how challenging it can be. And I see that on a daily basis. My passion is really around how I can help women be the best versions of themselves. But for many, it's even reclaiming themselves, going back to how they were and really not recognizing themselves as they go through that hormonal change.
What are some of the blind spots that maybe of information and the lacking of understanding that you're seeing within that work?
I think that, even though we know we're going to go through this phase in our life, it creeps up on you. It's a bit like the boiling frogs situation where, your body is changing and it's happening over a period of years. And so you don't notice those small changes. And because the symptoms of the perimenopause and menopause are so wide and varied, it can often be something that you're attributing to another reason. So, for example, women going through the perimenopause, if they have a sensitive gut, can quite often see their IBS symptoms increase. Well, of course, the focus is then on your gut and your gut health, and there's much that you can do to support that. But actually, the blind spot is that it could have an underlying hormonal cause. You might experience more frequent migraines, for example, or palpitations, or your skin might get drier. All of the above could happen, and yet they may not be attributed either by your healthcare practitioner or by yourself as being connected to the hormonal change. Because as a woman, you may still be having regular periods. So that's something that's going to happen to you in the future, not something that perhaps you're thinking about right now.
Yeah. And I know that one of the key aspects of the work that you do is you do have a slightly longer consultative process that you go through where you really do sit down and you talk to the people coming into the pharmacy and really understand the root of what's going on. How much more impact do you feel that's having with your ability to have these conversations? How much more benefit does that provide you in, being able to give the best advice that you possibly can with what people can expect and how they can look after themselves and the actions that they can take.
Johnny, it's massively important. Frequently our clients haven't had the opportunity to speak to anybody about this for longer than a few minutes. And so our consultation lasts an hour. And during that time, our client has the opportunity to talk about anything and everything that's happening to them. So it's a very holistic approach. We might talk about what's happening within their family, the challenges that they're having with their children or their partners or their elderly parents. And so aside from the clinical information that we need to get from people, which is around their previous medical history, the symptoms that they're experiencing, what medications they might already be on, family history, it's wide reaching. We also spend time listening to what's happening in their lives, because whilst hormones and hormone replacement fundamentally underpins managing the perimenopause and menopause, it's also about having a more holistic approach to life and how you can manage some of the challenges that inevitable, as you go through that transition. So the consultation is critical, and often women will say, I feel so much better. And I haven't actually given them anything at that point, but they feel so much better for having spoken, having offloaded, having been able to share some of their concerns, frustrations in a protected environment, perhaps articulating and voicing those concerns and worries for the first time.
Yeah, I think what you're doing in regards to that is absolutely massive. And I know that we've spoken previously about the fact that you've had feedback from people, it was just so nice to have someone listen who offered an ear for longer than a 5-10 minute consultation where they could actually feel heard. What really inspired your want to do the level of service that you're doing with REMEDI? Because it's not the usual. It's definitely an outlier, but I think it gives an indication and a North Star as to where we should be heading with community pharmacy and with pharmacy.
Definitely. I mean, it's, I operate a private clinic pharmacy, so I have the space and the capacity to be able to offer such a detailed consultation for women. So that's the first thing. And so it's not a model that perhaps could exist everywhere. But the principle that underpins what we do, I think, can exist and does exist in other places, which is fundamentally putting our client and her health at the very centre of what we do. I fundamentally believe that by listening to the person that's in front of me, I am in a much better position to be able to help them. And I don't go into the consultation with preconceived solutions or ideas. It's about really deeply listening to what's going on, because we're all unique. How I experience the perimenopause and menopause would be very different to the next woman that walks in through the door. Some women don't have as extreme perimenopausal symptoms, but actually post-menopause they might suffer more, and vice versa. Some women don't notice the symptoms, other women are paralysed by them. Some women have more psychological symptoms associated with their menopause, others it's more physical. So going into that consultation and fundamentally understanding what's going on for them puts me in the best possible position to be able to find the right regime, options, process, but always in partnership with the person in front of me. I'm not there to, push my my solutions on them. It's a joint decision.
Yeah, I think it's one of the things that in previous conversations we've spoken about, how you made a point there and you kind of you brush past it quite quickly, but that ability to step back and not make a prejudgment, not make an assessment ahead of the consultation and go through the whole process and act almost like a detective, piecing the parts of the puzzle together that ultimately gets you to the right outcome for the patient and to establish what the best course of action for them might be. With that in mind, and what's some of the information that you kind of wish was more available to people, or that they knew more about, that would mean that we'd actually be seeing more positive action being taken with the approach to perimenopause, to menopause, and to women's health?
Oh, gosh, so much. Well, first of all, we're in a lot better place than we were when I started my perimenopause, which was probably about 10, 12 years ago, maybe longer. So I went into my own perimenopause completely ignorant. Even, as a healthcare professional, I should have known better. But as I say, it creeps up on you, and you still think you're young.
You are.
You're just So I think the awareness is so much better than it was, and it's people like Davina McCall and many others have got the message, or are getting the message out there. So women are becoming more informed, which is fantastic. And podcasts and social media and various different resources can make a huge difference to that. But I still see too frequently women coming into the clinic who are suffering and properly suffering, and particularly with mental health issues around anxiety, depression, not feeling themselves, women that have given up or stepped back from their careers because they just have lost all sense of self and confidence. And at no point during that process in their consultations with their doctors has the possibility of hormones being raised. And I see that all too frequently. We know that the 40s and 50s are the most likely time for women to be prescribed antidepressants. We know it's a time of life when women are most at risk of suicide. And yet, frequently, hormones are ignored in the process. And correcting hormones, simply giving you back the hormones that you no longer produce, can be the difference between you living your life as you should be living it and being paralyzed by fear, by anxiety, by not being able to leave your house. So that's what I would like more information about, because we know that the psychological symptoms of low hormones and fluctuating hormones can happen several years, if not up to a decade, before a woman's periods change. So, of course, you're not on the lookout for it. Everything else is normal. So why would that be anything other than something's going on with my mental health? But actually, it may have a physical cause associated with it. So the awareness has to start at GP level, and making sure that doctors, as healthcare and other healthcare professionals, not just doctors, but other healthcare professionals, have access to good quality information and understand the impact of changing hormones and declining hormones on psychological symptoms. So that's really important. So, and women, of course, if they're more aware of that, can perhaps ask the right questions and potentially trial hormone replacement therapy instead of perhaps going on an antidepressant.
Yeah. One of the things that occurs to me there, as you said, you're looking at a potentially 10, 12-year time span before anything may physically change. In your estimation, or your thought process, when should women start really engaging in this conversation with their GP? If it starts at GP level, let's just say that maybe it won't be offered first. So there may need to be that request from them. When should they start to think about this? When should they, start to look at taking some proactive action? If that's what it may take, obviously that's not the ideal. But if we were to say that one takeaway from this podcast in the success that it would have is that there is a cohort of women who find this message and get to ask their GP about what it is that they can seek to do, and arm themselves with as much information as is possible to prepare themselves for those changes that are going to come, what should they be doing?
There is a simple message, but it's not going to be the answer. So, the average age of menopause in this country is 51, and the menopause is defined as a year post period, so not having menstruated for a year. However, we're not average, are we? Nobody's average.
There's no one size fits all.
So absolutely. So there's a message around the fact that we're all different. I think so what that means is that you could be in your mid-30s. you could be in your 20s experiencing hormonal changes and decline, which mean you're going through an early menopause or a premature ovarian insufficiency or failure. You may, because of surgery or cancer treatment, gone through a surgical or a medical menopause. All of these factors need to be considered. So I would like women and healthcare professionals to consider the possibility that whatever the age of the woman in front of them, it could be hormonal, and that should be investigated. But particularly any woman from early 40s, if we think about when most women are going to go through their menopause, any woman in their 40s walking into a doctor's surgery with a range of symptoms, or particularly, worsening anxiety, depression, which is new for them, that just doesn't feel that it's a mental health issue, but is exhibiting itself as a mental health issue, certainly should be considering hormones as a possibility, and perhaps being more vigilant, tracking different symptoms. There are some great resources out there. We follow a lot of Dr. Louise Newson's work. She has the Balance website with various different resources on it, fantastic for women to access, but also a tracker for symptoms. All of that, becoming more aware of your body. So that's not one message, Johnny, but a series of them. But I guess, we are all unique. We will experience this in our own way, but to be more vigilant to the fact that particularly this sort of plethora of symptoms that could be ranging from skin, dry eyes, oral problems, fluctuations of heartbeat, shortness of breath, IBS, mental health challenges and issues. It isn't just about hot flushes and night sweats, which is where we tend to focus our attention.
This is the key thing, to get that awareness out, that there is more nuance to the symptoms that are going to present themselves. It isn't, as you say, it's not just going to be hot flushes and night sweats. It's going to be, it could be, what you would maybe think is IBS. I might be stressed. It could be IBS, but a change in how you're feeling with regards to just feeling a little bit down, like not feeling quite right in yourself, and actually having those changes and having that awareness to be able to say, maybe there is something more to this. Maybe there is a hormonal element and a factor to this that should be considered, as part of the, the spectrum of analysis that I suppose you go under as part of the consultation process. Are there other things that, one of the things that also I know is a concern for some in the medical field around menopause is around osteoporosis and the bone density of women being at risk after that. And I know that there are, significant mortalities or after a fracture to a weakened bone. What can we be doing to strengthen some of those or improve some of those outcomes to give women a bit of more insight there?
I probably need to go back a couple of steps actually, because what we haven't talked about, and I think is fundamental to all of this, is that the perimenopause, and which is the period leading up to when our periods stop, and probably 10 to 15 years, if not longer, before that happens, our estrogen levels are overall declining. And during the perimenopause period, they can fluctuate wildly, which is why the symptoms can be particularly extreme. But ultimately, our estrogen is going down. And estrogen is such an important hormone for women, and men actually, but if we focus on women, we have estrogen, what we would call estrogen receptors, but where estrogen acts is throughout the whole body. So, which is why we then experience symptoms pretty much everywhere when those estrogen levels decline. So estrogen is a very powerful neurological hormone, which is why it affects our mental health and we get psychological symptoms, but it is in pretty much every vessel, mucous membrane, organ, etc. It's involved in bone turnover, etc. So when our estrogen declines, that's why we're getting symptoms. But estrogen is an anti-inflammatory hormone. So when we've gone past the menopause, we're fundamentally in estrogen deficient state. And I guess from a kind of biological point of view, we weren't designed to perhaps live that long. And we're now in long-term estrogen deficiency, which leads to an inflammatory process within the body. So we know that low estrogen puts at a much higher risk of osteoporosis and issues with bone density, but it also increases our risk of cardiovascular disease, type 2 diabetes, some cancers, and there are some increasing links to Alzheimer's. So that, all of that said, if we can replace the estrogen with hormone replacement therapy, what we're doing is not only addressing the symptoms of the perimenopause and menopause, but we're also helping protect our long-term health. And we've now got evidence that shows that women on HRT have a better outcome in terms of those long-term health conditions than women who don't.
Yeah.
So certainly choice to go on HRT, and which is part of the consultation, if you want to consider hormone replacement therapy and address this deficiency in estrogen, the discussion extends beyond symptom control and dealing with things like night sweats and aches and pains, joints, etc., and moves into protection for long-term conditions. And some women choose it on that basis.
Yeah. I mean, I definitely would encourage anyone that can have that to look at that option, because reading Peter Attia's fantastic book, Outlive, he massively advocates for women to be looking at that because of some of the associated risks that you mentioned, cardiovascular disease, which is one of those horrible silent killers that, the thing that scared me the most was that the first symptom of that is actually mortality. It's that scary. I know that this is obviously a centered conversation around particularly menopause and perimenopause, but I thought we might shed a little bit of light on some of the other work that you've done with REMEDI as well, because I know that it's not isolated to this area, and you are doing some other amazing work around, helping other people in the community. Would you like to highlight some of that for us as well, because it is incredible?
Yeah, thank you, Johnny. I mean, it's important to recognise, and actually let's just stay with menopause for a moment, in that when a woman is in front of me, it's also worth acknowledging that what she's going through and some of the risks associated with her health may not just be about her hormones. It certainly is important to have that discussion and to explore it, but I'm also mindful of other things that could be going on, and we need to take that into account. So it's not unusual for someone coming in to see us to have, for example, a broad blood screen and potentially other investigations, just to make sure, is there anything else going on? And we quite frequently, linked to the change in estrogen, will pick up high cholesterol and lipid profile changing, but also simple things and easily fixable, such as a vitamin D deficiency, but again, really important for long-term bone health. So, and there might be thyroid disorders and various other things. So it's important to not get blindsided by hormones. There can be, there can be other things going on, and hormones aren't going to fix absolutely everything, but they're a great start. But yeah, the other work that we've done, we're increasingly working in men's health. I'm very passionate about the importance of lifestyle to prevent long-term diseases emerging. And so, a broad spectrum blood test is a great place, particularly for our men to come in and do. They love their data, and being able to share what's going on and have it in black and white is often a huge motivator for things like weight loss, changing diet, looking at lipids, and just taking stock. Quite frequently pick up high blood pressure, which we know is the biggest global killer. So again, important to not lose sight of the other things that can be going on and how we can help in the prevention agenda. I think understandably there's a lot of worry when I speak to clients about cancer, and so we can educate people about the sort of red flags to look out for and the things that they should be mindful, the things that they can be doing, such as, you know, being active, having a healthy diet, not smoking, keeping drink within moderation, the sort of things that we all know are good for us, but actually reminding people about those. But we also are getting more involved in genomics and looking at ways of giving people more information around their genetic profile, so whether they've got an increased risk of certain diseases and cancers coming through. But the bottom line is we're more likely to die of a heart attack or stroke. So it's again making sure that we're not losing sight of those things and getting on top of them, because there's so much that we can do personally to take responsibility and accountability for our own health.
Definitely. Do you see the role that you are playing in having a part in the community? Do you actually find that having those relationships with the people that come through the door and being able to just have those almost like off the cuff conversations sometimes, how much of an impact that's greater are you feeling with some of those discussions? Because I think it's a strange situation where you've got, I can imagine it's almost, it starts a little bit more relaxed. If someone comes in, they're looking for something else, and you start with this, you know, building of a conversation, and then it leads much more naturally into a potential conversation around something else that might be bothering them, that might be at the root cause of discomfort or something like that. What's the impact that you see the role of a community pharmacy or a pharmacy in the high street playing, as opposed to a kind of quote unquote like GP's office? Or it seems the two have a strange.
We're somewhere sort of in between. I mean, I'm incredibly visible. In fact, you know, you've been to the clinic.
I have.
We're on a main road with a full glass window, so you can see into the clinic, and it's a very special space. We've designed our dispensary to be a glass cube so that people can see in, obviously protecting patient confidentiality, but it just, I hope, gives the feeling that we are very accessible and open. But having said that, of course, we've got private consultation areas. So we're somewhere hybrid between a doctor's office and, you know, a high street pharmacy that people would recognise. That ability to have a very accessible relationship with clients is incredibly important. And as we come up to our second birthday, we're really feeling that now, as people have built trust with us and they're very happy to come in and talk to us, and one thing does quite often lead to another. Yesterday, one of my very lovely clients that we've built such a relationship with, he came in with one of his friends. They're now just the banter just led to, they're both now in a competition to lose weight. They're coming in 2 weeks after the new year to come in, and it's all about percentage weight loss. They won't mind me saying they're quite big guys, and they both came into the consultation room together. They were both measured together.
This sounds like the very definition of healthy competition.
They literally, it was healthy competition, and It was actually a very, very special moment for me to be sat with these two guys, and they were sort of, you know, talking about how they were going to do it and the support that they were going to give each other. And none of us were expecting that, but it was the fact that they were able to come in together, and, you know, one of them had an appointment, the other there with moral support, and together they worked it out together. So, yeah, I think that accessibility is incredibly helpful and important, and the relationships that we're building with people. And I think, you know, there are, coming back to your point about community pharmacies, there are a lot of community pharmacies, the clue in the name, community, who are right in the middle of their population, whatever that population's needs are, and are responding to them day in, day out.
Yeah, well, that's the thing that really strikes me, that community part of it, where it's, you have an ability to really have a profound impact with the people that are around. And it sounds like through the work that you're doing, that's the sort of impact that you're having. And then obviously the layer on top of that is probably quite a significant convenience factor for, you know, you can come in, you can have that conversation, you can have that consultation, you can do a blood test, you can do these other tests, and actually then receive your medication from that same person, that's a wonderful thing to be able to do once you've gotten the results and had them explained. With the explanation of the results, I know that that's something that's really important as well, and the delivery of those results, where you've unpicked that trail of breadcrumbs, so to speak, and you've really gotten to the root. How have you found that aspect of the journey that you're on with REMEDI? Because I guess I don't know if that's usually the sort of running through a series of bloods or results is usually the role that I think most people would think of as a pharmacist sitting down to do something like that with you. How do you find that with the clients that come in and the relationship that's built and that trust with those types of things?
I think increasingly, and I don't know whether there's been any research done, but I would say the role of healthcare is changing, and the different roles that different healthcare professionals have as we're all learning and developing new skills to address the issues and challenges there are with demand outstripping what's there. Personally, I've been through a significant amount of additional training, and I'm
Yes.
now a prescriber, and so I feel competent to be able to go through those results, and but also recognise, as any healthcare professional would, where it's time to pass on to somebody who's a specialist. So one of the things we're very proud of at REMEDI Health is that we have created a wonderful network of real specialists so that we can refer on to gynecologists, to urologists, to gastro, to endocrinology, to cardio. So we can, and to various different screenings, whether that be MRI, CT, ultrasound, mammograms, smears, etc. So we can act as a conduit or a gatekeeper for a number of different services and specialisms, depending on what those findings are. But frequently there are issues that we can deal with very competently within the practice, and so I think that's and it's important for a member of the public to understand that whomever they're dealing with knows where to go next.
Yeah, I mean, that's the thing that it occurs to me, that I know we've spoken previously, and there is a much bigger role that pharmacy can play in helping patients and things like that as well, which I think is so wonderful that maybe public don't realise, and that your pharmacist is way more qualified than just the person that goes, here's your prescription filled, go ahead Johnny, take that. Actually they are, and more than willing often to have these conversations and the dialogues with you if you've got concerns about something and stuff like that. And it actually, the way that you described that there, where you have that wonderful referral network, it almost does remind me of, you become a part of that you are integrated into that healthcare system, and that's an amazing part that I don't think necessarily is so broadly visible to public often. And the work that you're doing and the way that you're operating at REMEDI, I think is such a wonderful example of that in action, and being able to kind of connect someone to the right person based on the results that they get through the tests and all that sort of stuff. So I think it's absolutely incredible. What are some of I guess one of the things that I'm always really intrigued by is, what are some of the things that stick out for you as kind of like some of the best experiences that you've had on this 2-year journey that you've been through with REMEDI, that you reflect back on and you go, absolutely, that gets me out of bed in the morning, that is exactly why I do this? And
yeah, I mean, where do I start? I mean, it's all about the individuals and the stories, and the obvious successes are those with hormone replacement therapy. Women that have stopped being able to participate in their families, in their jobs, in their careers, because they're incapacitated by the changes that are going on in their body. And yet it is so simple. Hormone replacement therapy, as we prescribe it, is body identical. It's very easy to get results pretty quickly. there are quite often some tweaking and, fine tuning that we have to do, again, reflecting that everybody's individual. But to see those women come back as we do after 2-3 months, we always review at 3 months, and their lives have changed. And we do monitor it. Every woman will complete a menopause symptom questionnaire on joining us, and then every time they visit us. So we've got some measure, albeit subjective, but some sort of quantitative measure of how they're improving, and they can see it for themselves. They feel it. So those are that really gets me out of bed in the morning, but it all does pretty much, because every time we interact with somebody, there's something that we can do to help, and we get such amazing feedback from clients who perhaps have felt that they've come across a brick wall in the current service, and the NHS is doing its best to do a great job, but it's really struggling at the moment, and I'm not quite sure how that's going to be fixed, and that's perhaps for you and another podcaster to try and work out. But we've had a number of notable diagnoses during the last 2 years, which have been life-changing for individuals, and often people just want answers. They know things aren't right, and they need to know where they're going. But it can be simple things. We do a lot of allergy testing, so discovering that you've got some allergies or some issues with particular food can make a difference. We do stool samples, urine tests. We do many different things. We help people going through transitioning. It's all good. There really isn't much downside other than the amount of time it takes out of my 7-day week to do it all, because it is hard work. But I have an amazing team, and couldn't do it. And everybody without them, I couldn't do it without them, and they are so committed to the same values and client service, really, to give people the best possible chance of the best health they can have.
How could you see a model like what you have at REMEDI rolling out on a wider basis so that it could have the same sort of impact that you are having with the clients that you serve, with the community, with the outcomes that you're seeing, the work that you just highlighted, and all of the amazing things that you're managing to achieve with clients? How do we get to a point where that's something that, how could we roll something like that out on a wider term basis?
Yeah, it's a tricky question. There's no doubt that what I'm doing, I'm sure others are doing, and it can be replicated. You've got to have the right people and the right mindset. One of true service, I think. So it's as much about attitude and mindset as it is about what we're actually delivering. I'm struggling with the answer in terms of just how challenging the NHS are finding it at the moment to meet the demand. GP colleagues are doing an outstanding job to just try and sort of keep just above their heads, above water, in terms of the number of people that they're having to see, and how they manage to do what they do in 8 minutes, 10 minutes, I have no idea. I mean, we've barely opened the discussion in that time.
Yeah.
In terms of digging and being able to deal with somebody from a kind of multiple symptom point of view and taking into account everything that's going on in their lives. So I don't know how they achieve it, and it's hugely challenging. So that's the bit I'm struggling with, how that could be applicable in an NHS environment. Privately, yes, and I'm sure many are doing a similar job, and that requires co-payment, doesn't it? It requires a payment from the client to be able to access that service.
Yeah. That's the thing, and that's why I struggled with the question, because I certainly don't want to come across like I'm not understanding of the challenges that GPs are facing, and the amount and volume of people and that they have to see on a daily basis, and the amazing work that they're doing. I do think it's one of those challenges of time. in an ideal world, you could give everyone that hour that means that they feel seen, they feel heard. You get to go through the process with them in a way that means you can really understand the challenges that they're facing, the mental, the emotional, the physical, all of it. And then prescribe a battery or whatever of tests, or it might even be nothing that you do. You literally are just hearing them out and you're hearing what they have to say. And so I guess that's one of the time aspect is the key challenge. And I don't think any of us have figured out how to buy more time yet. So answers on a postcard, if anyone figures that one out, please do let me know. And I think it's one of the bigger questions that I have is, if we were to summarize or take away 3 things that you would want people to take away from this discussion around, perimenopause, menopause, and women's health and what they can do, what would they be? What would you leave with our listeners and the audience to be aware of, to take away?
That's one of those questions that I most definitely could have prepared for, but didn't. So here we go. The first response would be information. So equip yourself with as much information as you possibly can. And therefore, information is power. If you're well prepared going into a consultation with your GP, then they're going to be in a much better position to be able to help you. Secondly, if you feel some things happening, a range of different symptoms, or you're just not feeling yourself, then it's worth considering hormones as a potential cause. What's happening to your periods? Are they getting slightly shorter? Are you missing the odd one? Are they getting longer in duration? Are they getting heavier? Are they getting lighter? It's often the first physical sign that hormones are changing beyond the kind of more nebulous things that we've talked about. And thirdly, I think it's really acknowledging and recognizing the importance of hormones to our long-term health, and the importance in terms of prevention. And I'd love to see some more research in those areas, because we think nothing of recommending, and it's within the NICE guidance, a statin for protection against a cardiovascular event, and yet estrogen's a really important hormone to make sure that you still have in your system going forward. Information,
Intuition, and then I'm trying to find another I, but I can't. Darn.
There is something else which I think is really important, whether you're a female, male, just as we age, and we are aging on a daily basis, it's about accountability and responsibility to your own health. And particularly actually in a health service that is under such pressure, it's incumbent, I think, there's your other eye, incumbent on all of us to take responsibility and accountability for our health. And, it might feel super boring to refuse the cake or not have that extra glass of wine, and go out for a run or go to the gym or whatever it might be. But actually all of those things are contributing. You're taking personal accountability and responsibility for your own health and prevention of disease going forward. Do we, and, don't know whether this is right for this podcast, but, are you going to be able to wipe your own bum at the age of 80, 85? And actually there are some things we can do now in our 30s, 40s, 50s, 60s that are going to help us be more mobile, more agile, physically and mentally, cognitively. We know what they are. They're not difficult. We don't need much more research that tells us that drinking too much, eating too much, not being mobile, smoking is bad for us. So, yeah, responsibility.
Yeah, definitely. I think there is, as you say, we all know the challenges that exist in the NHS and stuff like that, but there is a responsibility that also falls on us to really take on board the bit of agency and accountability of looking after our more long-term positive health outcomes. And there is a plethora of information out there. There are people like yourself doing amazing work. There are amazing clinicians and physicians in our NHS that are doing that work. And, you know, you will be able to prepare yourself with a little bit of information as to how you might be able to improve your health outcomes long-term as well. So I think that's a definite watchword in terms of accountability and, you know, having that agency to go forward. I know that overwhelm can be a bit of a thing sometimes in terms of, you know, there can be too much information sometimes, but it does feel like, as you say, we know some pretty fundamentals right now about overeating, exercise, drinking too much and smoking that are pretty nice pillars that we can say if we stick to, we'll be in pretty decent shape. Deb, this has been absolutely wonderful. It's honestly remarkable the work that you're doing, and I could talk to you for hours about it, as I'm sure we will do. If people want to find you, if they want to get in touch and they want to learn more about what it is that you're doing, where can they find you?
REMEDIHealth.co. Remedy with an I. Thank you.
Fantastic. Deb, thank you so much. It's been wonderful. Well, thank you so much for tuning in, everyone. As I said, please do check out remedyhealth.co with an I to find out more about the amazing work that Deb and her team are doing. It really is a North Star for where pharmacy can play a role in community. Please like and subscribe this video or wherever you're listening to this audio podcast. And we'll see you soon.